November 21st was the deadline. It is August, the survey team arrives today, and the corridor now runs just under 26 minutes, beating the target with time to spare. Time to show the work. This is LeanProjax in Action, Healthcare, Episode 9, The Survey Day. Before the board sees anything, the work gets its paper trail. A recommendation, formally logged. Roll out discharge by 11 to every ward. Link to the process it moves. Difficulty, low. Claimed improvement, 66%. The row lands with its baseline attached, so next year nobody argues about what was promised. Improve, closed out properly. Now the language boards actually speak. Money. First, the walkouts. Fewer people leaving without being seen is recovered care. $240,000 a year, hard. Overtime, down $90,000, hard. And the diversion penalties we no longer pay, $60,000, avoidance. The counter keeps score as we go. $390,000, year one. From a policy sentence, a QR sticker, and a float nurse. The board can check the math. And this is what Maya projects in the boardroom. The executive summary, live from the project, not a slide deck built at midnight. Process performance straight from the measurements. The charter summary, the promise exactly as it was written. The plan, every DMAIC phase with its dates. Voice of the customer, the complaints that started everything, linked to the numbers we chose to move. The combined Pareto, still showing where the minutes lived. The FMEA Pareto, ranking the risks we chose to prevent. And the root causes. 6 lanes, 4 suspects, 1 conviction. Every chart in this room clicks through to its own data. When a board member asks where a number came from, the answer is 1 tap away. That is the difference between reporting and evidence. For the surveyors, the one-pager. The A3 generated from the same data, background, current condition, analysis, countermeasures, follow-up. 1 page, in the order auditors think. Print it, hand it over, and every claim on it traces back to the system. No binders, no archaeology the night before. The surveyor reads for 2 minutes, nods, and asks to walk the corridor instead. Exactly what should happen. One gate is still amber. The processes section wants what every honest closeout needs. Real measurements on the process itself. In go the 14 daily means from the final weeks, the corridor after the last mile, and the gauge answers. CPK 1.45. Sigma level, 4.35, 7 defects per million. Rating, adequate. Hold on. Wasn't this the process that started below -2 sigma? Can sigma be negative? Yes. Sigma 0 means half of your days meet the target. Below 0 means fewer than half. Back in the spring, at 94 minutes, almost no day made it. -2.09. That was the before. Today, the corridor averages 25.8 with a spread under 1 minute. Sigma level plus 4.35. Same 30-minute standard. A climb of 6.5 sigma levels. The rating reads adequate, and the survey team can check every digit. That is why we remeasure at the close. Operations inherits a number, not a feeling. Now, mark the section 7 of 7, 100%. And the button this whole story has been building to. Mark assignment complete. Done. The project closes, and the control plan takes the night shift from here. 94 to 25.8, 390,000 a year, and a corridor that beats its target with a control plan standing guard. Cedar Gate is ready. When the surveyors walked the corridor, nothing was staged for them. A quiet waiting room, a green board, a chart drawing its own limits. That is the whole secret. Thank you for walking all 9 episodes with us. This has been LeanProjax in Action, Healthcare. See you in Season 4.